Hello and welcome to the Dr. Kate series. Today we're going to be talking about drugs and how that may trigger your seizures. As far as health is concerned, in some people, drugs may be a trigger of seizures. It is possible that suddenly stopping a drug, i.e. withdrawal symptoms, when addiction has already developed, may initiate seizures. All in all, there's a connection between abuse of certain substances and developing seizures. The mechanism may be either indirect, where there's cerebral trauma, stroke, or it affects your metabolism, or it could be direct, where there's intoxication or the withdrawal of a drug. These mechanisms are not mutually exclusive. So a patient with obvious overdose or abstinence might also have, for instance, meningitis or an acute hematoma and may simultaneously be intoxicated by one drug while withdrawing from another. The effects and risks of so-called recreational drugs vary tremendously. They may directly affect the brain in seizures or interact with one's seizure medication. The effects vary tremendously for different drugs and from one person to the next. So I'm going to spend a little bit of time talking about various drugs. Marijuana. Studies suggest that tetrahydrocannabinol, or THC as it's better known, which is the active ingredient in marijuana, and cannabidiol, or CBD, the substance in marijuana which doesn't cause the psychoactive effects, can help seizures as well as provoke them. However, not enough is known about which ingredients and how much of them can help or harm people with seizures. Often when we get CBD oil or if we get marijuana, the quality can vary from product to product. And therefore, we need to be incredibly careful about whether it's going to be effective and positive for us or not. Marijuana also has worrying side effects, and stopping marijuana suddenly after using it recreationally can increase the risk for seizures. Nicotine and caffeine, although these two are legal drugs, and if we have normal amounts, whatever that may be, occasionally there are stories of susceptible people who experience seizures, partly because it's difficult to determine what is considered normal. And different beverages, foods, and medications include caffeine. Caffeine may affect a person's seizures by interfering with sleep or may alter the metabolism of seizure medication. Nicotine has an effect on one's heart and blood pressure, and this can impact seizures as well for susceptible people. Cocaine. All forms of cocaine use can cause seizures within seconds, minutes, or hours after it's been taken. Seizures caused by cocaine are uniquely dangerous and may be associated with heart attacks because it disrupts the heart's normal rhythm. They can even occur in someone who has never had a seizure before. If you have epilepsy, you definitely should be avoiding cocaine. Heroin. Heroin and related narcotics are drugs derived from opium or are manufactured drugs to be chemically similar to opium. These drugs don't directly affect the likelihood of seizures in people with epilepsy. People who use these drugs often forget to take their prescribed seizure medications. Taking large amounts of narcotics can cause serious lack of oxygen to the brain which therefore can lead to seizures. Amphetamines and other stimulants. These are brain stimulants. When used under a doctor's supervision, amphetamines or other stimulants don't seem to increase the risk of seizures in people with epilepsy. However, there are a few exceptions. If you abuse amphetamines or related drugs like ecstasy, you can experience sleep deprivation, confusion, or major psychiatric disorders. When this happens, you're very likely to forget your seizure medicine, which can then trigger seizures. Some researchers have also found long-lasting damage to the brain from the use of some types of stimulants. Very high doses of amphetamines can cause severe tonic-clonic seizures, heart attacks, and even death. So the take-home message today is be very cautious of what you put into your body, how it interacts with your medication and with your brain. Lifestyles play such an important part in managing your epilepsy. If you want to learn more about how to manage your seizures and are interested in working together, go to my website, www.drkatehealthcoaching.com, and book a call with me. Thank you for listening. Bye for now.